Good evening and welcome to Money Matters. My name is Jim Butler with Vidiri Wealth Management, and my co-host tonight is Patty Tawadros with Studio X. Welcome, Patty.
Thank you.
Good to see you again.
It's always nice to see you.
Why don't we start tonight's discussion with kind of the new age of marketing, as I might call it, and that is more digital, online. In other words, getting away from print, which seems to be still used, but certainly not nearly as much. And I think you have an expertise and understanding of digital and brand marketing.
Yeah. You know what's really interesting about the online marketing is how you market really depends on who your consumer is. So if you're marketing to senior citizens that are in their 70s, they might look at Facebook to look at their grandkids, but that's probably the extent of it. And you probably still want to actually send them printed materials in the mail.
Okay.
But if you have a younger demographic, then you also still have to think about where do they spend their time? Are they on Snapchat? Are they on Instagram? Are they on Facebook, Twitter, YouTube? And then tailor your marketing to where your customer actually is.
So is there an age breakdown, like a rule of thumb, where a certain age prefers more print material or even radio or TV?
Yeah, absolutely. And it's also still the topic, right? So the type of person that's getting it. So if it's a mom, she might want coupons are going to be things that you send to her in the mail because she can cut them out. She has them, she sticks them in her handbag. But maybe if it's tips or, coupon codes for websites, and that's going to be something that you're going to digitally market to her. For you in wealth management and finance, that's a lot trickier. You have a lot of rules and guidelines around what you're even allowed to say online.
Right.
Right?
Right.
Yeah.
Well, it's interesting because there's a daily piece that's sent out over email out in central Chester County, which is where my office is based. Mm-hmm. And it takes about 3 minutes to read, has half a dozen stories. They're very short, but they're very focused on different businesses throughout Chester County. Sometimes it spreads beyond that, but what it turns out to be indirectly is a soft commercial for that enterprise or sometimes that individual, and it catches my attention.
And they're probably paying to get featured in there.
They must be.
Yeah. I know that one of my clients were going to be advertising in an engineering magazine, and we're paying to be in a newsletter that they send out that they're suggested products. Those aren't suggested products. Those are people that paid to be in that magazine. So you can never believe what you see in a magazine is actually a true editorial piece. A lot of times people are interviewed because of, how they advertise in the magazine or on their website.
Right.
Yeah. But
right.
What is interesting is how much you need to engage with Snapchat if you have a younger generation that you're engaging with.
So how much do you have to engage?
So none of my clients want to do it, but they need to do it because when they're after that younger millennial generation, especially people that are under 18, that's where they are. So if they're a clothing brand for teens, they need to have a Snapchat channel and they need to create filters and engage with kids there. If you're after, was really interesting, we have a client that makes flashlights, and we thought Instagram would be such a dead channel for them because their demographics are men. We wouldn't think Instagram and men, but the amount of men that go on Instagram and share photos of their flashlights, their knives, their, if they're military, police, their guns, home defense, it's crazy to me.
Really?
It's super, but it's more active than their Facebook page.
It shows you how little that I know, the kind of the online presence that I have, to a lesser extent Facebook, to a larger extent to some is LinkedIn and then Twitter, although I could certainly learn more about those mediums, really just in staying in touch with people, and that's how I would approach it.
I always like Facebook because Facebook, almost everybody has a Facebook account.
Right.
And even younger, like early 20s, they're creating accounts, even though, it used to be dead to the younger generation. It's not anymore. But what's great about it is even if you're going after a certain business segment, those people are still people and they still have personal Facebook accounts.
Right.
And they're still marking their interests and engaging, Facebook's smart, it knows what you're looking at, and it can deliver ads if you're advertising. So you can still get the purchasing manager, you can still get the end consumer that you're after. And it's a lot more cost effective than LinkedIn advertising.
Okay, that's interesting. And it certainly has to be mobile applicable or
Right.
adaptable, correct?
Do you know that when we advertise for clients, 97% and more of all the traffic to the website is from mobile? So when you think, well, someone's sitting at their computer and they're just typing away at their computer, and that's where they're going to do their research, maybe for vacation or for restaurants or, I don't know, anything. Things that you don't think people are going to use their phone for, they use their phone for. So 97% or more is actually mobile traffic. So
Interesting.
everything you need to do needs to be mobile friendly.
Well, if there's one posture that we see frequently, whether it's in a restaurant, in line at the grocery store, or walking down the street,
This.
very
yeah.
much. And people are looking at a variety of things,
Right. And that's where you got to grab them.
right?
And then you can use things like geofencing. So if somebody's within a certain radius, let's say you're going to the stadium, all the restaurants in the stadiums could participate in an advertising campaign where once somebody moves into the stadium with their phone, they can start to get messages. Maybe it's a text message or ads that show up in Facebook. So you can do advertising based on triggers like that, which is kind of creepy.
Yeah,
Right? You've
yeah.
probably gotten a lot of creepy things.
Amazing. It really is.
Yeah.
Let's jump into our question.
Okay.
Greg Lang in Philadelphia has written in and is asking, what are some smart ideas for online marketing, which really falls right in line?
Yeah, well, so the first thing I say is once you know who your demographic is, find them where they are.
But it's really to create engaging content.
People just scroll, right? We just talked about it.
You're
Looking for something to grab you. So you need to use a really bold, strong photograph to grab someone's attention with very little text in it, because you get penalized for having text in your images, so when you're advertising on Facebook. And I say maximize your dollars that you're going to spend. It's sometimes less expensive to advertise on Facebook than it is to advertise on Google. So do a little short test, see how much the click is on both platforms, and then spend your dollars where you're getting the most traction.
But more than that,
Don't just have that online ad. You need to have something on your website you're driving customers to, where you can capture a lead. Don't send them to your homepage. People are going to get lost and they're going to leave. So if they searched for a very specific article or topic service,
Okay.
send them to the page on your website that's about that specific topic.
Oh, interesting. So don't
Yeah.
don't take them to the home page, but specifically to the place where the answer resides.
Yes, so that they stay on that page and go deeper into your site.
Right.
Instead of landing on the home page and thinking, now what? There's too much stuff here. Forget it. This is too hard.
when you go back.
Right.
And search for a better answer to their question.
Right.
It's fun.
There's always something to learn.
Yeah.
And I think, there are more seniors who are gravitating to online marketing. And so to some extent, that opens up that age band as well.
Yeah.
So
Good.
that's great. Thank you, Patty.
Yeah, absolutely.
And if you have a question that you'd like us to address, here's the address and communication to send it to.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, M-O-N-E-Y, -matters, M-A-T-T-E-R-S.
Welcome back. Our guest tonight is Dr. Ricky Haug with Core Family Practice. Welcome, Ricky.
Great, thanks for having me.
Good to meet you, and we're excited to learn more about your business and the new direction that family medicine appears to be taking. So maybe take a minute or two and just, could you outline a little bit of your background and then the focus of the firm?
Sure. Yeah, I went to Temple for med school and Jefferson for residency, and when I finished residency, I joined a family practice at a hospital-based practice, so what most people probably typically go to. And I really loved the patients, but as time went on, the constraints on both the doctors and the patients in terms of the time you're allowed to spend with them, the amount of issues that could be brought up per visit, and not only that, just the EMR, the electronic medical record requirements for each visit that was required by the insurance company, just got to the point where I felt like I wasn't able to provide the best care. So I actually started researching other models of care, and I found direct primary care, which has been around for probably 20 years, but to a lesser extent across the country. The basis of that model is you're directly partnering with the patient. So we're taking the insurance middleman out of the mix. And so we work on a monthly membership basis, kind of like if you joined the YMCA or like Netflix.
Okay.
So you pay a monthly fee, and patients can come in as often as they want or as little as they want, but they pay that monthly fee. So I don't file any claims with an insurance company. Most of my patients have some sort of insurance. Some of them have great insurance. Some of them have no insurance. But we do encourage everyone to have some sort of catastrophic plan if they can.
So when they come to you, first of all, the only patients coming to you are members that are paying a monthly fee?
Correct, yes. So that you join the practice, and because what we're looking for is that relationship. And so we don't work as an urgent care. So if someone calls me up and says, hey, I think I sprained my ankle, can I come in today for an evaluation? We don't do that because I want to leave the spots open for the people that are members of the practice.
What if it's a member that's calling you for a last minute?
I fell and sprained my ankle.
That's a great question. We get them in. I mean,
Okay.
yeah. So, and that's one of the beauties of it. Every day I leave slots open. So there's never a day where I walk in the door and we can't get people in. I mean, I've gotten 6 people in same day appointments before. So we either get them same day or early next day.
And how long is
An appointment with you versus seeing my primary care.
Well, for a new patient visit, it's an hour. So we really get to sit down and learn about family history and patient goals and things like that. And then for follow-ups, they're 30 to 45 minutes. So we don't even have 15 minutes slot on my schedule.
Okay.
So even if it's a quick thing, I mean, we have some people who say, hey, can I run over and get a strep test on my lunch break? And they might only be there for 10 minutes, but we leave that open because oftentimes things come up. I mean, someone might be coming in for their headaches, but the root answer is maybe they're having depression or anxiety issues or something else that takes a lot longer to get into.
Right. So somebody could come in once a week, once a month, once a year. As long as they're a member, you're going to see them.
Yeah.
And
yeah.
you don't charge them any additional fee for what you're providing other than medicine, but then that's probably on them.
Yeah, so no, we don't charge any additional fee, and we have, so for any procedures, if someone needed stitches, I've gone in after hours and stitched a kid up, and they had a high deductible plan. We saved them $1,000 probably, and they didn't pay anything in addition to their membership. For freezing off warts or draining a cyst, any procedures like that. If I do a joint injection for knee arthritis or something, we just charge them whatever the medicine cost us for the steroid shot.
Okay.
If I do a skin biopsy, then we can either send that through, if they have insurance, when we submit the pathology, it can go through their insurance. If they have a high deductible plan where they don't want to go through insurance, or they have no insurance, then I've contracted with a pathologist who will do that for around $70.
Okay.
And we do have a lab there in our office, and we have a pharmacy in our office. And so there are additional costs if you want to use the lab. And the lab's the same way. We can do it through someone's insurance, or we have some negotiated pricing with Quest where, for example, if someone said, well, I just would rather just pay you cash, and for example, a cholesterol panel is $9 at our office. A blood count is $5.50, about that. So they're very affordable.
Different than what your insurance gets billed when you go through a traditional.
It is. It's drastically different. I mean, for a thyroid test, for example, I think in our office it's around $11, $12, something like that. But I've had patients who bring their bill in, and their insurance, when they went through the insurance, it might have been $100 or $150. There was an interesting article just recently in the, I think it was in the Wall Street Journal, about the difference in lab pricing across the country. It could vary from $1,000 to $30. And so it really, it's an unfortunate thing with medicine, the price transparency.
Right.
And with direct primary care, we're very price transparent. I mean, I could tell patients right off the bat what it's going to cost them for those lab tests. And if they say, you know what, I don't think I'm going to be able to do all those today, well, which ones, you know, and they'll say, which ones do you think are, you know, that we need to do today?
Right.
And we'll do them. And then with the pharmacy, I just order them from a wholesaler, and we pass the savings on to the patient. So I don't use that as a revenue generator. It's really just a service. So patients don't have to use our pharmacy. They're welcome to go to CVS or Walgreens. But oftentimes they save a lot of money. So we you know, make sure we cover our overhead costs. But other than that, I mean, this morning I had a patient walk out and pay $2.10 for their prescription.
Wow.
So
I also
So on your website, you do home visits?
yeah, that's actually a really fun part of the job, which
Very
is
cool. Did you get a black bag to go with it?
yeah, I do really enjoy that. So I probably have, I think, 8 patients right now who I only do home visits for because they're homebound.
Okay.
And so we'll go out and I'll check their blood pressure. We'll do whatever they need done. It's really great because you get to see them in their space, and usually their family or caregivers there with them. And it just gives them peace of mind knowing that someone's coming to see them, and they don't have to. You know, for some people, it's a huge burden to leave the house, and
Sure.
and it actually can cost them a lot of money if they need transport.
Right.
So yeah, it's a pretty neat part of it.
So will a member carry insurance? You said sometimes they'll carry catastrophic insurance. How about whether they have an HMO or just a straight indemnity plan? Could some members carry that as well as be a member of your practice?
Oh yeah. Actually, I would say probably 90% of the members of our practice have some sort of insurance.
Okay.
And it might be Medicare. It might be. I mean, we have doctors at DuPont who have amazing insurance. I have illegal immigrants who have no insurance, and
Right.
then I would say the vast majority of our patients though have high deductible plans. And so it may be in anywhere from $1,000 deductible to up to $13,000 deductibles. So a lot of self-employed people have a very difficult time getting affordable insurance, and so they might get something off the exchange, but it has those very high deductibles. So they're basically paying cash for everything. HMOs are a little bit tricky for it. That's probably the one insurance that's a little tricky for us. Because since I've opted out of insurance, I can't do referrals for a patient or those things. So I still have some patients who do that, and they have another provider they'll get the referral from, but they just love our model of care, or they may have been former patients of mine that wanted to stay.
So how much, how broad is it? What percentage of the market is direct primary care?
Oh.
And
Very low.
Very low?
Yeah.
And how low, and where's it growing most?
Yeah, that's a great question. I don't know the exact percentage, but I think the last I saw it was maybe 2%.
Okay.
I mean, it's very low. There's about 1,000 practices though across the country.
Okay.
And that number is growing astronomically, or exponentially, I should say. Because even when I started about 2.5 years ago, I think it was in the 400 range. The number of practices across the country. So, and at the direct primary care conferences, you're always meeting new people. I have people contacting me to start their practice. So it's growing a lot. In the Midwest, there's a lot in Kansas City area. There's a lot in Colorado, and in some of the western states. We're starting to see more out east. There's a few in Pennsylvania and Delaware and all along the East Coast. North Carolina has a lot of practices actually. And there's even some states that are starting to partner with direct primary care to manage their state workers. Because what they're finding is when a patient has a true medical home where they have access and they can go, and where someone's spending that time, they can save on the downstream costs. Even Medicare is piloting direct primary care in different states, and for their Medicare Advantage plan. So I think we're going to see things changing. 15-minute visits, you just cannot provide good care.
Right.
You,
Makes sense as a
yeah,
patient.
You just can't. I mean, if someone has multiple issues, you can't do a really good job on all those issues, no matter how good of a doctor you are. You just don't have the time you need to devote to that. And so I think that patients are getting frustrated with the current system, and a lot of family doctors are too. This isn't exactly what they signed up for in medical school. There wasn't their vision to just file through patients like that. So we're seeing that turning, and so doctors are starting to do more direct primary care, and patients are starting to look for it now too.
Do you get involved with integrative medicine, like bringing in different modalities?
Since you're not taking insurance, like acupuncture or chiropractic care?
I do. I don't have any in my office, but I certainly will work with other providers, and especially acupuncture. I mean, I actually prescribe it a lot. I mean,
Really?
the data is pretty good for back pain, for nerve type pain, and so I'll recommend patients get acupuncture quite often. I have some patients who will use a functional medicine doctor, which is a little bit different type of view on the way you care for a patient, and then we'll sometimes work together, with that, or with a chiropractor, the same kind of thing.
And are you growing your practice? Are you looking to hire more doctors eventually?
Yeah, actually, I did hire a new
doctor.
doctor,
Yeah?
and yeah, he's starting in August. So I started the practice about 2.5 years ago, and initially I think we had 20 or 30 people on the waiting list to start. And now I'm at about 550 or so. And my goal was to cap out around 600, because you want to make sure you have the time for your patient. That sounds like a lot, but in a hospital-based system, a full-time family doctor is seeing 2,000 to 3,000. That's the number of patients that are on their panel.
Oh my God.
Yeah. So I mean,
No idea.
yeah. So it's
Wow.
really hard to manage all of that. So now I know my patients so much better than I ever did.
How do you market yourself to the community?
Well,
And provide legitimacy.
yeah. I did work in the community for about 6 or 7 years prior to opening my practice. So my practice is in Kennett Square, and I was working 10 or 15 minutes from there for a while. So a number of my patients are former patients, and then my motto with starting practice was take really good care of the people you have, even if I only had 50 people,
Right.
and they market for us. It's pretty amazing. I did do some Facebook marketing. I did a couple ads and would go on the message boards and things. And interestingly, now I haven't done any of that for 1.5 years, but my patients will do it. If someone posts and says, "Hi, I'm looking for a new doctor. I'm kind of frustrated with the current system," or whatever, then you'll see our name will come up, and our patients will tie us to their page and stuff. So it's pretty neat.
So one thing we want to be careful of course, is that this show is going to air at different times than when it's being taped. So sensitivity to knowing how much growth there is going to be, not that the show is going to be on a year from now necessarily,
Yeah.
but certainly in the months ahead, based on what you've said, I would expect more growth.
I think so. I mean, I think there's practices every month. There's new practices coming up across the country.
Are they Ricky, based more with family care, or are some of the specialists getting involved?
Yeah, that's a great question. It's mostly family medicine or internal medicine doctors you'll see as well. An internal medicine doctor, they usually don't see anyone under the age of 13.
Okay.
And so that's a little bit different, whereas a family doctor will see an infant to any age. And some family doctors still do OB care even. So, but yeah, it'll mostly be family doctors and internal medicine. Sometimes there's some pediatric direct primary care practices.
Okay.
And I have seen some specialty offices starting to come up. I think there's a gastroenterologist down in Texas, and I've seen some endocrinologist practices. Interestingly, there's also a surgery center in Oklahoma where they only do cash-based procedures.
Like
you can
what?
actually go on anything.
Get your gallbladder out
Yes.
for cash?
You can actually go onto their website and type in gallbladder surgery, and it'll tell you, I don't know the exact quote, but it's very reasonable. It's like $5,000 or $8,000 or something, and that includes everything. And then if you compare that to a local hospital here, it will be dramatically different. I think a knee replacement is more, I forget, maybe 15,000 or something. And I think if you looked around Philly, it might be pushing 100.
Yeah.
But yeah, so it's really interesting. I think it just, when, one of the things I look at it, compare it to a little bit, is if you think about car insurance. So we don't use our car insurance to pay for oil changes or to even get our transmission fixed.
Of course not.
Yeah, you pay cash, you go to someone you trust. If you're very unhappy with the charge they're going to have, you might look around and find a garage where, hey, you know what, this seems much more reasonable and I trust this person. And so with that free market, the prices come down drastically. So, and it's the same, so if someone needs an MRI, you could call 3 different places and get 3 different pricing for that MRI. So when you actually know the cost of things, the prices will come down.
I know we're running out of time, but do you consider yourself a
Concierge doctor?
I don't, no. Concierge medicine's a little bit different. One is our price point's a little different. I charge $70 a month for an adult, and oftentimes the concierge practices have a higher yearly fee. But the real difference is that they still bill insurance. So if you go in there, you still need to have insurance, and you still have your copay, you still have your deductibles and things like that. So with concierge doctor, you're paying that premium to have some more time and access, but you're still using your insurance like you would normally.
Okay.
Yeah.
Interesting. And your rate structure, how did you determine that, and how often do you adjust that?
Well, I compared to other direct primary cares across the country to get a gauge of what would make sense. And then also just tried to factor in, well, what are our overhead costs? And, what costs do we need to make sure that we can keep this thing afloat?
Right.
And I raised the price once in the 2.5 years. I started out at $65 a month. And then in January, we raised it to $70.
Which is nothing.
Yeah.
Really.
And then for under 25, it's $35 a month. And we do family plans and things like that. So, yeah, it really, for when you think about the access, and we're available by text, by phone. I answer my phone.
Amazing. I think there's certainly room for more growth, largely because it's cost effective, and certainly the future of medical care for all ages is cost effectiveness. And it's great to see the private sector taking that bull by the horn instead of relying on the public sector to solve that problem, which they may not be able to all that fast.
Right.
So, great conversation, Rick.
Yeah.
Appreciate
Thanks
it
for
very
having me.
much.
I really appreciate it.
Absolutely.
Thank you.
Yeah.
So tune in to our next show, and our guest will be Al Gianchetti. He's the CEO of Xylacor Therapeutics. It's a biopharmaceutical company that is engaged in gene therapy. So that certainly sounds almost as fascinating as our conversation today. So thank you again for watching Money Matters.